Hi friends, welcome back to iihealth.com. Today we are going to talk about symptoms and testing of COVID-19 disease. Patient with COVID-19 may have mild to severe respiratory illness. Mild symptoms includes fever, cough, and shortness of breath, while the severe symptoms include pneumonia in both the lungs, multi-organ failure, and death in some cases. When to see a doctor? If you develop any emergency warning signs for COVID-19, you must seek medical advice immediately. So what are these emergency warning signs? These are trouble in breathing, persistent pain or pressure felt in the chest, bluish lips and face, and new confusion. A new confusion state is diagnosed when a person is conscious but cannot understand the time, the place, and person. COVID-19 is a new disease and there is limited information regarding the risk factor. Who are at the high risk? Those who come in contact with the infected person, people aged above 60 years because their immune system is not that strong to fight against the disease, and people with underlying health condition like heart, lungs, kidney disease, diabetes, and even cancer patients. Testing is done in laboratories of the state and local public health departments. The samples which are taken for the testing are the nasal swab, blood serum or plasma, and even oropharyngeal swabs. So what is actually done? First is the real-time reverse transcriptase polymerase chain reaction, and other one is antigen-antibody reaction. Most of these tests are real-time reverse transcriptase PCR diagnostic panels that can provide results in 4 to 6 hours. Viruses do have DNA and RNAs like us. This polymerase chain reaction basically identifies the COVID virus RNA from the sample and provide us a relative direct evidence of the disease. On the other hand, the antigen-antibody reaction basically detects the antibody against the COVID and thus provide us an indirect evidence of the disease. Who should be tested for COVID-19? Not everyone needs to be tested for COVID-19. Patient who require testing for the COVID-19 is with an acute respiratory illness having symptoms like fever, shortness of breath or cough. Even with a travel history to a residence in a location reporting community transmission of COVID-19 disease during the 14 days prior to the symptoms, or individual who come in contact with an infected COVID-19 patient. Even patient hospitalized with severe acute respiratory illness and in absence of an alternative diagnosis that fully explain the clinical presentation. If you have symptoms of COVID-19 and want to get tested, don't panic. Do communicate with your state and local health department of your medical provider. Thank you for listening. Do like and subscribe our page iihealth.com for more updates.